This week we're looking at what to expect from physical therapy itself, but first, our disclaimer. Mike Matthews, physical therapist here with the PT 4011. Thanks so much for joining me. If you already haven't done so, make sure you follow, like, subscribe, Facebook, YouTube, Instagram, TikTok, and Twitter. Also make sure you check out thept411.com. So today we're doing another WTE video, what to expect but not for surgery care. We're looking at what to expect for those that are trying to participate in PT. Seems pretty straightforward. Have problem A, go see PT, get treatment B. Not quite. Our aim is to match each person with the best treatment for their specific issue, and to do so, it can take some detective work at times. Now, for those who have had surgery and are getting rehab to recover after that, it's a little different. There are usually specific protocols with timing of treatments for safety reasons, so rehab is very similar for the same surgery with different individuals, at least early on. But as therapy progresses after surgery, things change as we work towards an individual's unique goals. The bulk of this video looks at those who have not had surgery that are going into PT. Now, depending on your states and its laws, you may have to get a referral from a physician first. So you get to the clinic, you check in, fill out paperwork. Sometimes these forms include a questionnaire exploring your pain and your current abilities and limitations. From these forms, we take scores to submit to insurance companies to prove the need for PT. Some of them require these. After the paperwork, when getting called back, you're already being judged by us. We're looking at how you are walking, your postures, your facial expressions, and so on. Same thing from once you have a seat. We're judging your posture pretty heavily. We get our introductions out of the way. We just jump into it. We start with open-ended questions like, what brings you here today? Tell me about your problem. We want to hear in your own words what's going on. Now, we want your perception of the problem. Yeah, some people may have had x-rays, MRIs, previous doctor visits, and diagnoses, but we're looking to start at the beginning. We want to have the same understanding of your issues as you do. Yeah, we look at radiology reports and doctor's notes, but it turns into a big game of telephone really quickly, and we can miss crucial pieces of information just like that. As we learn your point of view, we zero in on more specific questions. We're looking for patterns to lead our examination. I would say from the conversation, we can usually get a pretty good, accurate working diagnosis on what's going on, and the physical exam is just to confirm what we are already thinking or even disprove what we're thinking. So for the PT exam, we want to examine and measure range of motion, strength, flexibility. Depending on your complaints, we may even check reflexes, sensation, reaction to sustained and repeated movements, joint mobility, special tests. Now, these special tests are designed to check the integrity of the structure in question. Some of these findings will guide what we end up checking next. So now that we have a good working diagnosis from our interview and exam, it's time to determine if therapy is really appropriate for us. During the interview and exam, we are also looking for red flags. We want to be safe. Now, there can always be more serious and complicated issues that require care that we just can't offer, whether it's an immediate or potential eventual emergency. So we want to be able to rule those out and determine that therapy is appropriate. And if it is, it's time to treat. We may go hands-on for mobilizations on day one. Sometimes we don't, but we will go over some exercises and set up a good home exercise program. We make sure we can perform all exercises correctly and issue a detailed handout of them as well. Now, on the following visit, we monitor pains, we make sure status improves, we call audibles if needed, make adjustments as needed. We also challenge our diagnosis. Now, as presentations can evolve, they give us a clearer picture over time, so things can change. We'll keep bugging you for information on how things feel throughout all these follow-ups. Now, as things progress along, we challenge things more, and our ultimate goal is to get everyone back to their previous level of function, or even further than that if that's part of their personal goals. We make sure we set up people for long-term success. We need to establish maintenance and long-term exercise programs as we start to wrap up PT. Now just know, even when therapy is over, we're still available if things continue to change and take a turn. Let us know. Give us a call. We're always here to help. Now, I hope this video is useful for you. Again, I'm Dr. Mike Matthews, physical therapist here with the PT 411. Thanks for joining me.